bolster. Underneath. Good to go. Come back around. Okay, let's bring this arm out and on top of the sheet, please. I'm counting. There we go. Towel back down. Standing behind them puts you in a position where adjusting the sheet is always going to be safer than standing in front, of course, right? All right. Coming to the head. Sanitizer time. Here, about halfway through, is where if somebody needs a bathroom break, you can check in. You know, we're not in an enclosed space where it's quite as easy, but like that's where you want robe and slippers. You doing good? Good. All right. Head and neck. I'm going to try to just cruise through this as similar as possible to how I would actually do it. Making all those scalp-related muscles. This is the right shoulder, so I'm going to be looking a little bit more. I heard a sigh and I felt the thing. The sigh accompanied me finding the thing, so I'm like, all right. I used fingertips to find it, but I'm not going to use fingers to treat it. Come here, adjust, stabilize, stabilize, forearm.
Can you point out what you felt and then where you're going to push?
Yes, absolutely. Now I'm on something that might be related to it. It was lower mid cervical, so if I'm guessing it was like C5. Finding a trap spot, adjusting my body mechanics. There's something hiding there, eh? Okay, pressure good. That one can be intense. All right, muscle energy time for this one. She's doing great with her arm on the side of her body. In order to do this, they have to have their arm on the side of their body. All right, I'm gonna have you just shrug your shoulder a little bit. Hold it up. So I'm having her shrug, lift the shoulder up, and then she's gonna slowly let go and reach for your toes. And pull the shoulder down. That should create a good stretch. Good. And let go. Okay, lift up, hold, big breath in. Okay, slowly let go, reach, exhale, exhale, exhale. Okay, good, let go. Okay, lift up, shrug, inhale, and slowly exhale and reach, reach. Good, let go. Now I'm gonna be on the area that I found. Here I found somewhere in there, deep and close to the spine. Now what's nice about using the forearm here is I don't have to be so targeted. What I can do is say, all right, we found that spot. I'm gonna ask the client, now you tell me when I find that spot that I was on earlier here, okay? I'm just gonna be working with my forearm. And you please let me know when we find that. Is that a little low or close?
It's near.
Good.
Not sure.
Too sharp?
I think.
No. See, I need that feedback. So if you're in an area where you're searching, just get their input. It'll help you an awful lot. That should be better. Okay. Let's sink in, pressure. That feeling close? Okay. So we're on it vaguely, but I'm using a broader base. So it's not going to be as targeted as my fingertips. So what I'm actually going to do, as is best practice, work on it with a forearm or a broader base of compression. Do that a few times, then go back with your fingers and see if it's still as sensitive.
Right there.
Oh, it was higher up than I thought. All right, Here we're on the neck, so I'm gonna incorporate just some small head movements. But with head movements, sometimes it's nicer to just be, to encourage that they're very slow, very small. Little circles with your head. Very slow, very small. So repeat with me. Very slow, very slow.
Very
Slow,
slow.
very small.
Very small.
There we go. And then they can actually make it more intense. She just did that. She found a point. It's like you kind of find that spot and you're able to push into it. I'm just the tree. I'm just a tree and a bear is what. It's not the best analogy.
No, that's how I feel right now.
But they can push into you and increase the intensity. It's much safer that way than you just guessing, right? All right, contact with upper track, swooping up, finding the base of the skull, and I'll be thinking of, watch how much my elbow is flexed. All right, now what could I use? Eye movements. So eyes closed, make circles. Again, switch direction, switch direction. And good.
Oh, something pops. Nice.
And now that if things pop, especially when it's as passive like that, it's a good thing. The number one thing about a pop is as long as it doesn't hurt. All right, arm, watch. I can adjust the sheet. Come up, starting real high, rolling them forward, so I'm not on the scapula. I want to be on the ribs, so I have to bring them this way, then more straight down. I'm still a little bit on the scapula. Okay, pressure okay. All right, now we're thinking about breath, we're thinking about stress, thinking about all the things, but my intention is the diaphragm will engage. The belly breathing will begin. Good deep breaths.
Alright, so it's okay.
One more good one. And take that back. I feel like we got a good stretch happening. Yeah. And again. Again. All the way out. Good. Excellent. Okay, arm forward, wherever is comfortable. Okay, then over the sheet. Here's our main low back spot. There's where I'm gonna have to search. If I needed to, this would be a good place to either adjust the table if you have hydraulic or get on the step stool. Be higher. All right, looking to come straight down. That certainly is something, isn't it? Okay, too much, or is that okay? Okay, breaths, start with breaths. You probably won't get tested on it, but the name of the structure here, where all the connective tissue point, where all the muscles meet, it's like a seam that all the muscles are stitched into and that they share. It's called the lateral raphe, R-A-P-H-E, raphe. And just every structure you can think of related to the low back meets here in some way, from superficial all the way to deep. Those would include the obliques, transverse abdominis, quadratus lumborum, psoas, the erector spinae and paraspinals, and the lumbar dorsal fascia in general. So that would also include like muscles like latissimus dorsi that come down and meet. And here's a case where it's a little bit of a lot. I don't think it's any one muscle that's causing a lot of the symptoms here. the stuff more lateral felt quite tight. As I track more posterior, now there's more of a thing. Tell me when it's just right. Good there? Okay. Little tiny lift of the bottom leg. Yeah, there we go. That should make it better. Okay. And down nice and easy. So coupling a couple of things. Compression plus active movement, but then we can also do breath. So lift, big inhale, exhale, and let the leg back down. And something happened. I'm going to switch one more spot. I keep on working my way more and more posterior. Here. Okay, I had more of a one back there. That's the one. Yeah. Let's do that again. The lift. Big inhale. Exhale and down. One more, lift, inhale, and down. Good. And then move. Okay. Lower leg. Well, that leg, I should say. Let's scooch you back. Good. See, I keep the sheet well bunched between the legs. Here we go. Motion. Only just a little bit. I'm still focusing my attention on the superficial layer first. And I'm just distributing lotion, feeling that nothing feels too stuck. The skin is moving. It's all happy and good. That's great. This is the knee that needs a little bit more attention. Pressure. Okay. So I just slow down. Make those glides last a little bit longer. Go across. Seems to move better that way. It's having a harder time moving this way. Now there, things felt better, but there's still something in the adductors. One option here can be to bend, bring back. Is that comfortable right there? You okay? Okay, knee, you feel safe? Okay. I usually want this to be touching the table, but it puts me in a position where I can be working and getting joint movement at the same time. So kind of a hack for knee-related stuff. So as I glide, so that knee's moving. I don't want to get into the nuances too much, but the adductors are definitely involved here. Something to remember forever is that the main channels for the lymphatic system and for all blood are more medial. So even if my goal was fluid movement because there was swelling of the lower leg, that would also be an awesome way. I would just use lighter pressure, but I would get that pumping at the knee joint while gliding towards the core of the body. It's a big win. I've needed started with the wrong foot. There we go. Okay, this gives you a better angle on how I'm coming behind the Achilles. Your knuckles are on an angle, so see how that lines up pretty good? Don't gotta be like that. Just like that. Wrist stays nice and stable. And if I'm gonna pick one muscle that I usually target here, I think about the big toe. So I'll grab the big toe, shorten, lengthen, and then stretch. The big toe is a very important toe. You don't have to go any higher than that. Just let your pressure lighten up, come back, and restart. Lots of little steps. Okay. Here, hand underneath. I usually make sure their toes are on my hand or forearm. And here we go. Sometimes going downhill is okay, just be careful it doesn't get your shoulder in an odd angle. And remember, that foot already got worked on in Sidelying. This was the top foot, and this foot was the bottom foot. Right. Go. My challenge with ever doing the demos, and in general, is time management. So you're seeing me falter just a little bit. But I don't want to skip too much with, I think I want to make sure we see plenty of sidling. So we're real close. I'm just going to be kind of moving along a little bit faster here. That fibularis. So joint movement, compression, plus joint movement. There's lots of ways to do this. This is my favorite. Ooh, that was a good speed bump. You see how I just am using my forearm? I just have to do this. Compression plus movement. That's the big one.
Like, it's gonna hurt.
Yeah.
It's doomed.
You have to be a little careful up by the head of the fibula. That peroneal nerve does come a little bit superficial, so make sure you're not too aggressive at a tender point here. Am I getting close?
No, not to the bathroom. Good. Like it's,
No, I want to be on kind of this higher up.
yeah, right there.
Okay.
Oh my God. Yep.
Okay. Now, still. Okay, ankle, toes. Oh, I rolled off of it. Okay, now, want to try not to agitate it. This is near that nerve. Roll, find a position with your ankle that makes right where I'm pushing feel better. Hold it there, hold it. So static. Good, let go. I looked up, estatica or estatico? I think this is, I don't think it's right. Okay, on it, okay. Position, find a happier place. Okay, that should make it better. Makes it more?
It brings it to the front of the thing.
Oh, okay, so it changes it.
Yep.
Okay, slowly, let go. Okay, one more time. Don't overwork areas. This is probably, there, that was a lot more. Okay, good, let go.
Yeah, that pain when you push on there, it's almost like someone's hitting my ankle bone with a mallet.
Yeah, but that is a nervy area, so you have to be a little bit careful there. It's very high. It's the go like near the fibular head. This is just, it's not, you want to make sure you work around there, but it's just be a little bit careful because it's where a nerve comes a little bit more superficial. Same thing on the lateral outside edge of the foot. Okay. Now, what oftentimes I frankly look for when using movement as part of the therapy is not always that the spot I'm pushing on becomes less sensitive or it gets softer, but that the movement becomes easier. And that's what I saw there, was the sensitivity might not have changed much, but the movement increased and felt more fluid. And that certainly tells us something for future sessions, where something's hiding. And I could go do some additional research, ask a mentor or somebody about like, I found this kind of thing with a client, what should I do in future sessions? But in your first experience of discovering it, don't use that as the moment to throw everything you know at it, right? Do a little bit, note it, confirm with the client that you'll be sure to put that in the paperwork and we'll be able to target that further in future sessions. It's a way to encourage a couple of things, that it can't be a one session fixes everything kind of dynamic, but also this confirms that you care and that you are going to find a way to be able to target these spots more thoroughly in the future. We have to manage, there's a little bit of managing expectations, and just especially in the early sessions, you don't want to overwork and cause something to be more sore. It's a little bit of a way of saying, yeah, let's just see how it responds. Next time, we'll try it a little bit more. I'm finding a big toe thing, and so I'm applying some direct pressure and then moving the toe. There.
Yeah, that foot constantly feels on the edge of the Charlie horse.
Mm-hmm.
Like if I just stretch it wrong. So.
Now, with cramping behaviors, also don't overwork. You'll cause a cramp. They're probably causing a cramp related to protective mechanisms from instability. Okay? So this and that makes sense that they're guarding up to stabilize the ankle and something up at the fibula. But that would relate to the ankle because the fibula, you know, goes to the ankle. And if during a massage something starts cramping, stop doing the joint movement, whether it be passive or active, static compression on the area, wait for the cramp to dissipate, and then just move on. It's saying it's not accepting your influence. Right, knee up. Okay. And then here, and this should be okay. I can just cover the arm and go that way, and I can hold the sheet nice and taut on this side and go and turn on your back for me.